guys, it's my 30-week update, and there hasn't been a whole lot going on other than the gestational diabetes diet, which honestly feels like a part-time job, making 6 meals a day for myself and all being as fresh as possible, fresh veggies and low carb, and going on walks after lunch and dinner, making sure I'm getting like the sugar out of my blood as much as possible so I don't have to go on medicine. I did do a sort of like gestational diabetes in a day, like what I ate video, and I will link that up here. I put that up yesterday. It was from Easter Sunday that I kind of tracked and recorded what I did. And I met with it's called the maternal fetal medicine yesterday. And then I met with the nutritionist for a second time today. And my numbers have been good in the past couple days. In the beginning, they were a little rough. So maternal fetal medicine said if I am more than 50% high on my blood sugar numbers, then they want to get me on medicine. So it's really important that I get my numbers down and keep them down. And I think just real quick, some of the tips if you are dealing with it that I've learned is yogurt's not, I mean, it does say high protein, but for some reason that really spikes my blood sugar. Bananas spikes it. And then if you miss like your snack at night and you want that snack to only be like 15 grams of carbs and really high protein. So that really helps with your fasting blood sugar. And then my nutritionist said that I could maybe work in some desserts, which excite me. So like if I did like a salad with no carbs for dinner and then had like a small dessert with it, that might work. But it makes me also think that I might be hungry, like it's not enough nutrient calories. But so if I can get my numbers, like keep them on track for like, 3 days, maybe the 4th day, I'll try to do that. So when I did my ultrasound, it was kind of like an anatomy scan, like a 15-minute version of it, where they just sort of check some things. And I saw her stomach and her kidneys, but she's breached, so her head is up, and the other thing she's doing is facing the back. So it was really hard to see her face. At the very end, we could see like a profile of it, kind of. And she was like moving her hands and being really cute, because of course she's cute. And I saw like her leg. So everything's good. Like the things I worry about with gestational diabetes are the size of the baby, and she's in the 48th percentile, which at 10 weeks ago, the 20-week scan, she was 49%. So she's on track. She was 3 pounds 7 ounces according to the ultrasound tech, which seems to be on track for 30 weeks. And the other thing they look at is the fluid. And if there's too much fluid, which can be a symptom of gestational diabetes, then that can cause your water to break and for you to have preterm labor. And they said my fluid levels are fine, which is so crazy that they can figure that out with ultrasound. So her heartbeat was 161, which she said was good. And the other thing they said is the placenta's in front. So I was like, well, what's gonna, like, is it, breaching, she's not in position? And she said there's plenty of time for her to move, and she's like, you're really gonna feel it. I was like, wait, what does that mean? Like, what is it gonna feel like? She's like, I don't know what it's gonna feel like, but there's not a lot of room in there, and she's gonna somersault, so you're totally gonna feel her like move into position. So that's kind of creepy. From now on, I will be doing an ultrasound every 4 weeks, so once a month. And then starting, not next week, but the week after, I start going into maternal fetal medicine twice a week. And I need to send in my chart for my, my nutrition and carb count and blood glucose levels every Tuesday as well. Oh, the other thing that was interesting was I asked the ultrasound tech if she thinks that 4D scans are like bad for the baby. Like I read in one of the pregnancy books that usually the ultrasound techs are not very are not well trained, I guess, and that we don't really know if all that ultrasound exposure is good for the baby, so that kind of freaked me out. But my doctor said it was fine, and then this ultrasound tech said, no, it's fine, but I'm glad you asked, because in the position your baby is, with the baby's face facing back, you're not going to be able to see her face on ultrasound. And her machine actually did 4D, and she switched it on, and you couldn't see anything. Like, you could see the top of her head, and she said like the umbilical cord was in the way. And I really haven't had any new symptoms. For some reason my belly hasn't been as itchy, and I haven't been applying the coconut oil and the I think it's jojoba oil as much as I needed to in the past. I don't know if it's like the belly isn't growing as much or what, but from now on the baby is going to be gaining 1/2 pound a week, which is nuts. I feel like we're hitting the home stretch. I'm going to be like, between maternal fetal medicine, I have to do non-stress tests at those 2 times a week appointment. So between like non-stress test and OB appointments and ultrasounds and tracking all of this, I'm glad I'm not that busy at work. I don't know how I would do it, or I'd be really stressed, and apparently stress, oh hi Chester. Apparently stress will increase your blood sugar levels. Come here, boo-boo. Come here, Chester. All right, so I will show you the 30-week bump. It's my 30-week bump. So baby's head is up here, and she's facing this way. I got these camo pants. I think they're Motherhood Maternity from Macy's. They are so comfortable. They're on the thin side, so I haven't been able to wear them very much for winter, but hopefully spring's here. Thank you so much for watching, and I will see you guys next week at 31 weeks. Have a good week, everyone. Chester, come here. Chester loves this room. He's like ruining the rug.